This is the CJSN podcast, and my name is Pierre Giguère. I'm a clinical pharmacy specialist at the Ottawa Hospital. And with me today is Swapnil Hiremath, who's a nephrologist at the same center. Today we will discuss our study, Management and Outcome of COVID-19 Infections using Nirmatrelvir, Ritonavir in kidney transplant patients. Kidney transplant recipients are at high risk of poor outcomes with higher morbidity and mortality with COVID-19 infections. Nirmatrelvir, Ritonavir has been approved in December 2021 as early outpatient therapy for COVID-19, but its uptake in kidney transplant recipients has been slow, mainly because of fears of drug interactions due to Ritonavir's severe inhibition of the cytochrome P450. Hence, using Ritonavir and a calcineurin inhibitor together will lead to accumulation and severe toxicity, and several case reports have reported exactly this phenotype. Several other concerns include the complexity of dosing calcineurin inhibitors after Ritonavir discontinuation, and the challenge of drug level monitoring and kidney function during active COVID-19 infection.
Faced by this catch-22 situation with severe morbidity in the initial Omicron wave in January to March 2022, we decided to consciously and deliberately use Nirmatrelvir Ritonavir. We held tacrolimus and reduced cyclosporin dose to 20% for the 5-day duration of therapy and an additional 3 days to allow cytochrome P450 generation. We also measured calcineurin inhibitor levels around 2 days after the last dose of Nirmatrelvir Ritonavir and restarted or increased the dose of the calcineurin inhibitor based on this level gradually. In the second phase of this study, we implemented a protocol to standardize the dose of the calcineurin inhibitor and reduce the number of serum levels during the first week following the end of Nirmatrelvir Ritonavir therapy. In this study, we report our experience and avoid the twin threats of subtherapeutic calcineurin inhibitor levels with acute rejection or supratherapeutic levels and drug toxicity. Overall, among the 51 kidney transplant recipients who received Nirmatrelvir Ritonavir, none of them developed acute rejection or other complications. Withholding calcineurin inhibitors for an 8-day period starting the day before and continuing 3 days after was associated with a low frequency of supratherapeutic levels and AKI, but also with a short period of subtherapeutic levels, which was of unclear significance. Our approach was quite resource intensive, requiring clear and repeated communication with patients and significant pharmacist and nursing workload. Nevertheless, we demonstrated that Nirmatrelvir Ritonavir may be used in transplant recipients receiving calcineurin inhibitors after taking appropriate steps to hold calcineurin inhibitors and monitor levels. However, we still need higher quality comparative effectiveness data as well as long-term safety data of the approach described in the study.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.